Joining us now is Infectious Diseases Expert Dr. Edsel Salvaña, who is also a member of the DOH Technical Advisory Group. Good morning, Dr. Salvaña.
Hi, good morning, Ruth. Good morning to everyone who's watching and listening.
Doc, the World Health Organization said the pandemic is nowhere near over. So what are you seeing, especially here in the Philippines?
Right. So in places like Metro Manila, which has a relatively high vaccination coverage, what we're really seeing is something we call decoupling. Like even if we're seeing such high cases, record cases per day, we're not seeing the same amount of hospitalization that we saw during the Delta wave last August and September. In fact, in one of the hospitals I go to, we have like one COVID ICU patient and all the other beds are empty. There are a lot of patients in the wards, in the regular beds for COVID because they have comorbidities. They're being admitted for other things like a UTI or some abdominal infection. And we incidentally diagnose COVID with them on testing because that's required when you admit someone in the hospital. But, their lungs are clear. As long as they're fully vaccinated, we're not really seeing any kind of severe COVID among the vaccinated cases. What we are seeing with severe COVID are those patients who are not vaccinated or partially vaccinated. So it's really made a huge difference. I mean, W.H.O does not want to say that Omicron is mild because it's not. It's milder than Delta, but it is still COVID, which can kill people. But what we've really seen is that the impact of vaccination on Omicron is that it has decreased the risk of dying from this virus by over 90%, and the risk of hospitalization is at least decreased by half for most people. So very, very important that we get everyone vaccinated.
Mm-hmm. But here in Metro Manila, like yesterday, we saw just nearly 23,000 cases, so it's a lot lower than in previous days. But we're also seeing an increase in cases in other provinces outside Metro Manila. Like earlier, Caroline Bonquin was reporting about a surge in the Cordillera region. So what does this mean?
Right. So the increase in cases in Metro Manila, as you know, is always ahead because this is where the biggest international airport is. And so you're going to see, even with strict quarantine rules, there's going to be some breakthrough. Of course, there are people who also broke quarantine, and that doesn't help. But these surrounding provinces and also places with high traffic like Baguio will have what we call the Omicron spike, and they're already starting to see Omicron cases in Baguio as well. Now, because Omicron is able to infect people, even if they're vaccinated, although still at a less clip compared to someone who's completely unvaccinated, you will see an increase in infections. But what's really important is to watch out for how many severe and critical there are. And in places like Baguio, where there is a high level of vaccination, then you will be able to temper the number of cases that need to end up in the hospital. Part of the problem with Baguio, similar to Metro Manila, is also a catchment area for surrounding provinces because it has more healthcare facilities than the surrounding provinces. So there will be pressure from those surrounding provinces, especially if those surrounding provinces have lower vaccination rates. So, as this works its way through the Philippines, we're going to see these increases as each province ends up with its Omicron spike. But the question of whether they will be able to cope really rests a lot on just how well they vaccinated in the time that we've had before this Omicron spike.
Mm-hmm. Doctor, today marks the start of the vaccine rollout in some pharmacies and private clinics in Metro Manila. So how do you see this to speed up the inoculation program? How many vaccines will be deployed? And this is still for free, right?
Right. So, the private sector has been a very, very essential partner to the rollout of vaccines, especially like in their workplaces. This is but a natural evolution where we're starting to give more freedom to our partners in terms of helping vaccinate the public. The hope is that eventually these vaccines will get certificate of product registrations. In the United States, for instance, Pfizer has already gotten that, and that paves the way for it to be given by doctors and nurses outside the government program. The real problem is that this is a special designation. Our vaccines are under emergency use authority, which means that they can't be sold and they can't be used outside a partnership with government. But at some point, now that we have a lot of data, safety data, efficacy data, once the FDA gives registration certificates, fully approves these vaccines, then it'll be a lot easier to get vaccinated, whether it's within the government program, which will remain free, or in private for whatever reason, convenience, or you're just more comfortable with your doctor, then, I think this will really help get our numbers up.
Mm-hmm. Dr. Salvaña, like what you said earlier, Omicron is milder in terms of if we compare it to Delta. So many people are isolating at home or in isolation centers. Can you just give them another reminder on how to deal with this? Because Secretary Duque was saying that some people actually still go to the hospital even when they can treat themselves at home.
That's correct. It is important that we keep the hospitals free for the more severe cases and for those who need to be in the hospital, even if they have mild COVID, but they have other reasons to be in the hospital. So first of all, if you are fully vaccinated, whether or not you're boosted, and you do not belong to the high-risk population, elderly or with comorbids, your risk of dying from COVID, from Omicron, is actually less than 0.1%, which is about that of the flu. So, we don't test everyone for the flu. We don't isolate everyone for the flu. So it's very important that if you feel symptoms, the most important thing you can do is to isolate so that you don't give it to other people. And for the most part, if you're not part of the vulnerable population, then isolating at home is fairly safe. If you're uneasy, call your doctor, call the DOH hotline or the LGU, and supportive care can be done. Now, for those people who have comorbids but are fully vaccinated or are greater than 60 years old, it is important that we test them, because if we test them and they are positive and they only have mild symptoms, if we give medications within 5 days, that further decreases their risk of progression to severe. So these are the medications like Paxlovid, Molnupiravir, even a short course of Remdesivir, which has also been shown to decrease the risk of hospitalization by up to 87%. So we have all these interventions that can be done that can further decrease the risk of getting hospitalized or dying from COVID. Now, as for the unvaccinated, the best advice I can give you is really just get vaccinated as soon as possible. Otherwise, this is still going to be 2020 for you. And then for the younger people who can't get vaccinated, below 11 years old, hopefully we're going to be able to roll that out in February, because you need special dose vials for children. And those who are going to be below 5 years old, in general, children do okay even if they're unvaccinated, but that doesn't mean the risk of severe COVID is zero. So we really, really still want to get them vaccinated as soon as possible. And a lot of effort is being put into that, and hopefully we'll get those vaccines for the kids as soon as possible.
Finally, Doctor, I just remember that you said last week in an interview that in a press briefing that the government needs to move away from blanket testing and instead opt for sentinel surveillance. What do you mean exactly?
Yeah, that's correct, because even places like Israel and Canada have actually stopped using RT-PCR or even testing people who are not part of the vulnerable population. Why is that? Because if you're fully vaccinated and I find out that you have COVID, your management is going to be the same. You're going to stay at home. You're going to isolate. I'm not going to give you any antiviral treatment. And because Omicron is so contagious, we expect lots and lots of people to get it it's going to be very difficult to test all those people. And the problem is that if you go out and test, you might actually just infect other people. So, antigen tests, self tests, or no tests, but you're in a place where there's a lot of Omicron going on. It's important to isolate if you have symptoms. Because even if you have a negative test, but you have cough, colds, flu-like symptoms, and the positivity rate in the community is about 50%, you're not necessarily going to believe that negative test. And so the action point is the same. And this is kind of a global mind shift where we're thinking that, as long as we got everybody vaccinated, the risk of dying is low. It's very similar to the flu. Once you're vaccinated, we don't test every single person for the flu. And doing blanket testing is actually still going to miss a lot of people. So it's not going to really give you an accurate view of the numbers. However, if you do systematic sampling, meaning that you actually do testing for people at different random intervals, you can actually get a better picture of how much transmission is going on in the community with a properly selected sample. And that will give you better knowledge than, just trying to do blanket testing and missing people who don't want a test or people who can't get a test and using up so much resources. And it's very important that we prioritize those people who can benefit from getting detected early, like the elderly, the people who have comorbids, so that we can give them the antiviral medications that further decrease the risk of ending up in the hospital and dying.
Thank you very much to DOH Technical Advisory Group member Dr. Edsel Salvaña.